All right, here we go. Welcome to our July 2024 State TA Day webinar. First State TA Day for our fiscal year 24-25. And already this year has been off to a bang. We have lots of things to talk about today, some new initiatives, hopefully some troubleshooting. And yeah, like I said, we have a pretty busy schedule, so we're going to work to keep it on track. And we will start with Miss Brenda Mays, who is going to give some ECPC updates for us.
All right, thanks so much, Charlie. I'm going to go ahead and share my deck as I move through this, but that's what I'll see. So if anybody has any questions, please clue me in. Let's see here. I hope I did this right. Let's see. Are you looking at that? Can you see the deck?
Not yet. I can also, let me know if you want me to drive it. I'm happy to if you want to.
Yeah, would you mind so we can stay on schedule?
Yeah, no problem. Give me one moment. Okie dokie. I'm doing that. Does someone from my team mind just putting a link to the agenda in the chat? All righty.
All right. If you wouldn't mind going back to that first slide. Thanks.
There we go.
Perfect. Okay. So I see Joy on screen. Joy and I take care of the early childhood professional credential. And today is basically just to kind of update you with state fiscal year end data and some tax information from the Colorado Department of Revenue. So that's where we sit, Office of Program Delivery, Early Childhood Workforce, and Registering Career Pathways, with Jen as our boss, Jen McDonald. Next slide, please. So I want to tell you about the team because a lot of the time we think about the work, but might not celebrate the people behind it. So real quick on the next slide, Charlie, who I have is how we operate. So you'll see in purple, it's Joy and I, we're CDEC, and the other 4 individuals are from Metrics IQ. We have contracted with Metrics IQ for the review of the early childhood professional credential and external training that's submitted. So there's all those beautiful faces. These are fun and silly people. We got to work with them the other day. We were so happy to sit next to them and just go through some processes that we were changing. So thank you, Julia. So we're really excited about working with this group in particular, and we'll be doing so for at least the next year. 2 more state fiscal years, including the current one, okay? Next slide. Okay, just a refresher, what we're responsible for policy, procedure, and process, everything ECPC and everything ET. So where does that feed? Next slide, please. Again, we're responsible for the credential and the ET. This is what happens when you don't operate your own deck, Charlie, sorry. And here's where we want to be. Yes, okay. So what do? Well, we process the credential, which also feeds into the QRS rating sites. And Joy is in charge of that. Joy reviews all of those applications and reports those levels for the QRS rating. We also keep our eyes on that early childhood educator tax credit, the external training review, and then we handle all the customer service regarding what we just listed. But I just wanted to also throw out there that our credential and what we award feeds into the trainer credential, the coach credential, the IT specialist credential, the DQ pathway, and the ECT pathway. So just kind of reminding everyone how we're all connected in ECPC. Next slide, please. All right, so Joy and I said, hey, what can we live with promises to the field? What are we actually capable of doing with our current workload? And so we came up with 3 promises. The first one is that the ECPC, we want to get it a 14-day submission to review state. Notice I didn't say completion, because sometimes we need a lot more information than we're given initially. So currently we're at 7-day turnaround, and that has been fairly consistent since November of 2023. So we are staying right about 7 or 8 days in most weeks that I reviewed, okay? The holiday weeks get a little wonky, but you understand how that goes, right? But we try and stay where we need to be. The next thing I wanted to say is external, why did I put external development? Interesting. External training review. That's a 14-day submission to review. That is even tighter in that that's a 1-day turnaround. And Joy, I don't even know if there's anything on there right now. I think I had 8 this morning to review. So we are still looking really good. Under a 1-day turnaround, Joy, is that correct at least? Okay, awesome. And then our phone calls and emails regarding that whole list that I talked about before. We're in a 24-hour or less turnaround. Unless Joni's thrown something my way, I don't currently have anything in my queue. And I know Joy keeps up with everything even better than I do. Okay. The next slide, please. All right, I want to talk a little bit, and I'm not going to get too crazy on you, but Joy will tell you I love visuals, I love graphs, and I love to create them to tell stories. And so I have a couple for you today, but again, the stories are going to be short stories today. Okay, next slide. I just wanted us to get a picture of how we've grown in this space. If you look at state fiscal year 2022 at the bottom, these are how the early childhood professional credentials are coming in. These are the submission numbers. So take a look at how we've grown from 2022 to 2024. In blue is the total, in red is the average per month. So currently, that metrics team is reviewing about 225, 230 applications per week. So they're staying on top of things. Next slide. All right. So we talked about that goal, and I think I may have mentioned this already, but I just wanted you to see where we were clear back. That would have probably been about 7/23 when we first started tracking how we were turning things around. And you saw it got a little nasty for a while, but then we got it under control. And again, since November of 23, we've kept that under that 14-day turnaround as we promised. So we're feeling really, really good about our solid processes and procedures. And I'm feeling super good that Joy's on the team, because Joy is just like watching out for everything in this space. Okay, so we're just happy. We hope this continues. We anticipate it continuing, and just know that we're watching it and we're tamping it down when we see things get a little bit too close to that 14 days. Okay. All right, next slide, please. On top, I don't want you to think we're just processing. We're getting credentials out, yay. Well, that could be wonderful, but if they weren't accurate, that would be horrible. Okay, so what we also do is we pull a sample to audit every month, and we have that sample include all levels, all of our reviewers, and what I do is I go through and I just look at their work, and I basically review the application again to see if it was done accurately. So we started out again when that last contract started, we started out with about 86%, dipped a little bit. We have our status meetings every week. We talk to each other. We make sure we're all on the same page. And as you can see, it's consistently stayed with their statement of work promise of 95% accuracy. And so we're looking good there as well. Okay. Oh, let me talk about that. Will you go back one, Charlie? I'm going to confess something. I cannot process monthly a sample size that is going to hit 95% accuracy. That's why you see that 90% there. I would be spending a week doing that. So what I did is I went to 90% so I could deal with a sample size that I can process within a week while doing the rest of my work. Okay. But keep in mind, we're still talking and we're still making sure everybody's on the same page. Next slide, please. I thought this was really interesting because what we did back in March, the question came up, I wonder how many people have not applied in our 3.0 system. If you'll recall, on 6/15/2021, the 3.0 system launched, okay? So as we were working through tax credit business and other stuff, we're kind of thinking, wait a minute, I wonder how many people didn't apply in the new system. So we sent out some information in our PBS newsletter in March, and at that point gathered some data, and the 2034 had not applied into 3.0 system, but we kept talking to people and putting it out there, and we got that all the way down to 72 people who have not applied in the new system, which is kudos to everyone, because that means the difference of the 2,000 to the 72 are those who remain credentialed. Okay. Next slide, please. All right, so we got some Salesforce data on credentials awarded, and I just wanted to give you a little snapshot of where these levels stand, because the level directly relates to qualification to do a certain job role. So I just want you to see most of our folks are around a level 2, right? So that's going to be an assistant, toddler program staff, early childhood teacher. So we have a lot of folks credentialed to do that. But it was interesting because I wish I had some baseline data for this, but I feel that we are awarding more and more levels 4, 5, and 6. I think that has a lot to do with that TSR training, like Leah's business with EQIT, Leah and Eva's business with EQIT, and Robin Levy and the Pyramid Colorado models. I think when people take those, that's actually what's increasing these levels, because if they do that, the training with special recognition, they get the formal education component. 3 components are necessary for a level 4 through 6. So just some changes we're seeing, and I just want to report out on that for you. Okay. All right. Tax credit. Let's see what we have so far. We have some preliminary data. Next slide, please. All right. This is not complete data. Okay. This is preliminary. And I say data, also data if you like. This is preliminary. Okay. And because when we get this data, we know that folks still really could change their tax filing through October. So just know 13,564, those with an active ECPC and who have been awarded the tax credit in 2023. Okay, they've been awarded the tax credit. So that's over 18 million is what went out in tax credits that we know of so far. I'm guessing that number has grown, but we don't have that number yet. This tax credit covered 98% of our counties. I don't know the county that we missed out on, but it covered 98% of our counties. Now, the last number, remember this is preliminary data, and if we have about 24,000 licensed direct care in our workforce, that means that basically 55% so far have received the tax credit. Okay. All right. Can I get some celebrations for this money that's going out to people? Come on, everybody, hit those celebrations. Okay, thank you. All right. And then on this next slide, this one's really telling. So these are the tax years that we've tracked so far. I wanted to let you know that we really don't have complete tax credit data except for 2023 right now. But what I would like to call your attention to is the last column, which is increase over the prior tax year in ECPCs awarded by tax year. Now, yes, you can say, well, that's because there was a tax credit. So we got all these credentials going. I like to think of it as that means that many more professionals are out there ready to be hired, currently working, and that what we're doing is actually starting to solidify. Okay. And then the 2023 increase is 33% over the prior year. So we're still growing. Okay. All right. Next slide. Oh, I'm recruiting. Okay. So here's the deal. I have an appeals committee that I'm responsible for. And in that appeals committee, I feel like we're missing some voices, okay? So I just want to let you know, if you have the capacity and are in Head Start, Early Childhood Council, Family Child Care Home, a director or teacher, or a representative of a 2-year IHE or a 4-year IHE, and you have 45 minutes every month on the third Thursday of the month between 1 and 1:45, you could help us review first level appeals and second level appeals. I will tell you, most are first level appeals, and the way this works is they send an appeal through Salesforce. And in that appeal, I do the initial review, and then I review the original award, what I found with this committee. We schedule 45 minutes, but I think we've consistently stayed under that to like 30. Just saying. If you have some time, there's my email address at the bottom of the screen. All right. And Joy's already on it, so she can't volunteer. Okay. The next slide, I just want to remind people, Joy, if you have this deck up, would you mind dropping the sign up and the calendar in chat? We love to tailor sessions. We have our slide deck that's kind of like, okay, this, and this, and we talk about this all the time. But we love to tailor the conversation to whatever you need. So if you have something in particular you want to talk about, complain about, ask me why it's not part of ECPC, or just say, hey, have you ever thought of this? Please join our sessions, and we're happy to discuss that with you. I want you to please think of the work that we do is, yes, it's policy, and we are really strict about the policy. But if there's something that we're not recognizing that would serve our Colorado professionals, we need to know about it. Sometimes, not sometimes, we just don't think of everything, okay? So please let us know. And then you're also welcome to get on that calendar to, yep, of course, Julia. We also want you to know that you can get on the calendar for the PDIS itself to get some navigation tips and some information about reporting experience, keeping profiles accurate, all that other business, okay? Was that my last slide, Charlie?
Yes.
Ooh. Oh, I went long. Sorry.
That's okay. This is important information. We'll be able to make it up. No worries, Brenda. We appreciate you so much.
All right. Thank you. Thank you for this time.
Thank you. Thank you for the amazing work that you all have done. And wow, the place that we're in now compared to where we were last year, especially 2 years ago. Thank you. All right. I believe SSBI is next. Hi, Megan.
Hi, Charlie. And yeah, Brenda, I am going to be shorter than anticipated today, so that's perfect. Kristen does not have any updates today, so it's just me, and I'm going to share my screen on, here we go, this slide deck. Okay. So if you don't know me, my name is Megan LeClaire. I am a project manager in the State Systems Building Initiatives team at CDEC, and I am the project manager in charge of shared measures. So I'm just here again today with a brief update. So a lot of this will be repeat for those of you that have been attending these regularly and ECLA Hot Topics, but just want to pop on whenever I get the chance to give a couple reminders. So here's a reminder on the timeline of shared measures. So back in May was the first time that I spoke to you all about this year's ECC shared measures reporting. And then during the month of June, I instructed you all to just prepare for reporting by identifying who from your council was going to be working on the shared measures this year and adding your contact information to the spreadsheet. And then reporting began July 1st. That's when the Google form opened, and it's due August 15th, just as every year. So that timeline is the same, about 6 weeks of time for you all to collect the data for the shared measures. And we have about a month of office hours sessions scheduled. So you can still, you don't really have to sign up. I guess I should change that wording. But here you will see the 3 that are crossed out are the ones that have already happened, and there's still a number of sessions upcoming. So if your contact information was on the spreadsheet that's been shared, you are already added to all of these office hours calendar invites. These are different than we've done in the past. They're drop-in office hours, so they're optional. You don't have to come. If you have a question, you can join. I will be on the calls for the entirety of the time frame listed. So the entire hour and a half or 2 hours, I'll be on the call, just hanging out. So if you have a meeting during a certain time and you're only able to join in the last 20, 30 minutes, I'll still be there. So they're just pop in, and I just answer folks' questions in the order that they pop into the call. So that's how we're doing it this year. If you're not added to those office hours and you would like to be, please email me and I can get you added. The reporting guide and the Google form are linked here. I'll share the slide deck with Charlie so you all have it in case you've lost those links. And then in the guide, you'll also find links to the Google form. So, and all the other relevant links that you'll need, like the EQIT reports, the Head Start reports, everything like that is in there. This year, I'm pulling all of the PDIS reports for you. And so I'm almost done. I've been working for the last several days on this. They're in your Google folder. So I have like 6 more councils to get to, but I'm working on it all day today. So they'll be done by the end of today. So you'll go into your Google folder and you'll see reports from years prior, if that's helpful for you to reference as you're filling out this year's. And then also there's a folder for PDIS reports. So it's one of the workforce measures that asks you to choose your prioritized competency. And so whichever your council is choosing to focus on, you'll be able to find that report in your Google folder. I'm putting all of those reports in there for you. So just in case you want to look at them, they will all be there, but you only need to report on one of them. Okay, and I think I had one more reminder. So just as always, please don't download the guide because we manage versions on that Google Drive link. So anytime there's an error in the guide or a broken link, I go and fix it in my software, and then I update the PDF on the Google Drive link. So if you download it, you're not having the most up-to-date version, if that makes sense. So just use it in the Google Drive. So when you click on it, you don't need to download it. You can just use it in the preview mode. You're still able to access all the links that way. And one final reminder, if you are working on the Google form in phases, it's kind of frustrating the way that Google form operates, but because of our data team's ability to use Google Data Studio to analyze all of the data that you're inputting, we have to use Google Forms. So if you're working on it in phases, you have to remember to click all the way through to the end and click submit. Otherwise, your form responses will not be recorded. So a lot of times what folks do is they just wait until they have all of their data before actually inputting things into the Google form, just because it's easier, but you can do it in phases. You just have to make sure to click all the way through and submit so it saves. Any questions? Here's my email address. I've been out of office a lot for some work travel, so I know a couple of you have emailed me that I need to get back to, but please email me with any other questions and join office hours. That's a great way to get in touch with me when my email's kind of a mess. But any questions right now before I pop off? Okay, thank you all. I know you're working so hard. This is crunch time, annual reporting, shared measures. It's a lot at once. And so I know how hard you all are working, but this data has proven to be super helpful for you all in so many different contexts. So thankful to work with you, and I'm here to support. So just reach out if you need anything.
Thank you, Megan. All right. I believe we have Christopher joining us. Let's see if he jumped in. Oh, there you are. Hello.
Hi, Charles. Hi, everyone. Thanks for having us. Yeah, we're here. I'm waiting for my colleague Erin as well to join. She'll probably pop in a little bit. She had a meeting right up to the end here. So she'll probably pop in here shortly. But we're ready to present whenever.
Right, yeah, sounds good. Feel free. And yeah, sorry, we surprised them today that they were 10 minutes.
Oh, sorry.
So that's our fault.
No problem at all. Thank you. Great. So yeah, hey, my name is Christopher Jordan. I work with a company called Propeller, and we're been contracted by CDC to really look at all of the different websites. As you all are far more aware than I am, I would imagine. There's been a long process of moving CDC towards, really building the department out and really unifying. And what does that mean to pull everything together? And our goal is really to analyze what websites there currently are that are owned by CDC, and then looking across that broader EC system and space and understanding how we can give recommendations to integrate better across that whole ecosystem. Just a couple of key points we'll just look at is kind of what our project is, why unification, what it could look like, some keys to success for our project, and our timeline, and then we have a request for support from for you all as well. So I'll just hop right into this and just talk to you a little bit about why unification. So when we talk about website unification, I want to just caveat this by saying we're not looking to take every single website that ever existed from CDC and pull it into a single website. We're looking at how do we unify across the internal systems, but also across our brand and our voice. How do we build what is the right size for all of this for us? And really looking at what is necessary from a user perspective. So we see users as families, we see them as providers, professionals, we see them as the ECCs themselves, legislators, all different groups, as well as internal CDC staff. So there's all these different groups of people who are collaborating to really figure out what the right size, the right opportunity is. So our proposal will take the view of probably something that's a phased recommendation over many years to get there. It's not something that's going to happen overnight, and it's not going to bring we're being very mindful about how we don't want to create outages or any problems as we bring a more unified picture into frame. So what is unified? Proved experiences for families, providers, professionals, partners, which we've already mentioned. We want to also improve the timeliness of content, making sure it's up to date. Consolidate access points. We want to have many different doors, but we also want to make sure that those doors are very specific and are targeted towards the right users. We also want to improve the navigation. Right now, if I'm not sure if you guys, you can just throw your thumbs up or a hand if you felt that navigation, or if you've heard the navigation on any like cdec.gov is difficult. Have any of you had any challenges finding content on there? But yeah, right. I see Charles. Well, what could we be talking about, right? So our goal will be to try to figure out, how do we really make these sites very navigable for the people who are using them, all right? We also want to clarify our governance around ownership, guidelines, preferred practices for choosing platforms and technology. Right now, we have many different sites with different platforms, different processes, different owners. And as you can probably guess, and I'm imagining some of you have experienced, that means that content on one site and another site sometimes is not up to date or does not agree, or there might be, gaps to service, right? We service families across, the whole age spectrum, but sometimes they don't know about discrete services because they're all held in different places. We want to get governance more centralized and get people to really, so we have a shared idea, and so that we really make sure that everything is up to date and we're doing our best service for those providers. For those families. We also want to really reduce risk, complexity, and cost. As you can probably imagine, 15 websites, 8 different platforms, 5 different vendors providing this maintenance. This is really causing a lot of complexity that's hard to manage and keep everybody on, different people have different things bookmarked. There might be different websites printed on materials. There's a lot of complexity, and this creates tons of risk, right? When we change something, we remove a website, we remove information, this creates a problem where all of a sudden we may create a loss of service unexpectedly. We want to really create a system for how we can tighten that up there. So with that, I just want to pause there. And also I want to welcome my colleague, Erin Maitland. She's just joined us as well. Just ask, a show of hands, how does that feel like a good goal for us? Does that feel, you give us a thumbs up if you think so. And if you have questions, you can throw them in the chat. We'll just give a quick pause. Great. I like seeing those thumbs up. So that was a great. Thanks, Diane. Thanks for everyone for sharing that. Thank you, Danielle. Great. So, all right. And great. So when we talk about unification, one of the things we also think that could mean is, pulling ourselves. We mentioned about 15 different sites. We thought maybe that could look like having, more like 3 sites, and these sites built around specific experiences. So what we see here is up in the corner, this Colorado Shines, branded thing. There's a lot of, maybe a version of this moves forward for and is expanded so that it really focuses on providers and professionals and those experiences. Maybe we have this site, which some of you may have collaborated in, providing input on as they were developing this Raising Colorado Kids Guide. This could be a central location for all family-related content. And then we would maintain the .gov site and reorganize it so that it focuses more towards like those legislative requests, media requests, one-pager program overviews, things of this nature. Our goal is not that information lives on only one of these sites. Our goal is that the right information for the right audience lives on the right site. So if I'm a family user, I want to go to one website and get all of the information I need as a family user, all of those, information about benefits, getting childcare. What if I have, maybe I need childcare and early intervention and safe sleep help. I have 3 different children with 3 different sets of needs. So I want to be able to find all of that information in one place rather than having to go to several different places to find that if possible. Same for providers and professionals. I might want to be able to find a single place where as I go through my journey, as I move between different provider centers as a professional, that I carry my life I carry that information with me, right? And that's discrete and easy for me to find. Also, Finding training is more straightforward, and I have a unified vision for my career pathways and development. So I'm going to pause there, and I'd like to ask you two questions. One, what concerns you about this? And the second one is, what excites you about this? And if you want, you can go ahead and just drop those in a chat. I'll give it about a minute for you to throw your ideas into the chat. What concerns you about unification? And what excites you? What opportunities do you see there? Mm.
I think the only thing I'll mention is that this will be definitely easier to navigate. I think it's hard when all three of these are on one website to really know where to go, especially if you're a provider or a parent. I think as an organization, as a partner, I've been able to kind of figure it out pretty easily, but I think as a parent, it would be confusing on which one I should click on or where I should go just to get directly to where I need to be. So I appreciate this separation.
Great. Thanks so much for that, Lisa. That's really helpful. Sounds like Jennifer agrees on that. And I see Diane in the group also commented as well, similar, like keeping it streamlined, 3 clicks. So navigation, that's one of our key focuses. So when we look at that, one of the things I'll note out is you can't really see them very well in these sites, but if you did click into the link for those future state wireframes, which is in the deck that's been shared with you, you can see those top menu navigations. Each of them is different, but focused on the specific audience. So when we think of providers know which programs they provide, and professionals know which programs that they work within oftentimes. So that navigation is organized more around programs so that you can go right to that purpose, as well as having key links for licensing and training and development. The family side, on the other hand, they're more problem oriented, right? What can you help me solve, right? So we've made that navigation more focused on childcare, for example, or seeking, mental health care, things of this nature. So it's more about that perspective as well. So that is a key goal of ours. I also see Charles a concern, too many cooks phenomenon on the back end will be difficult to ensure all info is updated. Yeah, and that's what we've talked about with governance, right? Our goal with governance is to provide really strong recommendations on how CDC on the back end will manage this, so that way it is streamlined, and so that way we do keep information up to date and we avoid that too many cooks phenomena, right? Yeah, separation, we like the idea of organizing information to respective websites. Concerned with something getting left behind or forgotten. Yeah, part of our process is to really map out where content is and give clear guidelines on where that content exists going forward. And the program teams will be very much integrated in this process as well, so that they can really ensure that content doesn't get left behind. All right, I see more, and I'd love to comment on all of those. I want to just point out to you that we'll collect all of these comments and evaluate them. But in the meantime, I'm going to pass this, I believe, over. Let's just make sure. Yep, I'm going to pass this over to my colleague Erin right now to walk us through some of the keys to success for us.
Great. Thanks, Chris. So hi, I'm Erin Maitland. Sorry I was a little bit late here, but I'm working with my colleague Chris here on this unification effort, and I'm really focused on the change management side, meaning I'm more focused on the people side and ensuring that the stakeholders that are going to be impacted by any of these changes are supported and adopted by and can adopt the changes. So that being said, just want to quickly go over some of our keys to success. I'll try and keep this brief because I know we want to get to our specific asks. But first, our roadmap is going to take some time to complete. So we're taking a phased approach in developing our roadmap and really prioritizing the user experience along with the feasibility of changes. We are also working to more proactively communicate ahead of time with any relevant program teams along the way and make sure we're really bringing them along on the journey with us and having their input in the changes. We also want to continue to celebrate the unique voices on our current sites. So we've developed some individual use cases over time. A lot of great effort has been put into this and dedication. And so we're very much committed to honor those as we move forward as well. Also want to point out that some of the websites have been identified for sunsetting, and it's possible that others could follow. And our objective in sunsetting certain sites is really to improve service delivery and support. We're not making these decisions lightly, and have also involved very key stakeholders in those sunsetting decisions as well. So you can see the sites that were identified for sunsetting now in that sub-bullet on the third item on the slide there. So let us know if you have any questions or concerns there. And then finally, your voices and opinions really matter to us. The success of this project really relies on your active involvement and support. As one of our biggest connectors to the impacted stakeholder groups, we really want to ensure that we're gathering your feedback and also bringing you along on that change journey with us. And so if you would like to participate or have suggestions, questions, concerns, please feel free to reach out to Chris. His email is on the screen here. We'll also throw it in the chat. I don't know, Chris, if you would mind just throwing it in there real quick. But in addition to reaching out to Chris, just curious if you have any ideas on some other good ways to involve you and make sure we're getting your feedback as we plan for changes, whether that's, attending regular meetings, sending regular updates, but just any initial thoughts on this? Feel free to throw it out in chat again, or just yell it out. Okay.
I think I would say I'd love to know when things have been updated. I mean, we do use materials off this site, and if it's being updated potentially with the same link, that will help if we're doing it electronically. But if we're printing materials, it's always good to know that something's been updated, so we're not using an outdated document. I know that might feel like a hassle, but I think it's just to make sure that we're all on the same page. And I think the other piece is, I know that I've been in touch with the communications department just a little bit about one of your parent materials, because we've had some families that want some changes to that. So I don't know if you guys take input from community on what people are saying they want changed, or if you, I know when I reached out to you, you said that we could just create like a complimentary document to go with it, which is fine too, because not every community is going to want the same thing. But I didn't know if there is a process for giving you feedback from what we're hearing from providers or from families on certain documents.
I may defer to Chris to see if he has any thoughts on that, but I think, we'd be interested in any input that you have if you want to reach out directly to us.
Yeah, I just want to clarify too for Lisa and for others. We're contracting for specifically towards this initiative. So sometimes if you've reached out via help desks or to some other to some of the programs specifically, we may not be privy to those conversations. And I would encourage you to continue to take some of those concerns, like about how to approach some of that day-to-day tactical stuff with them. We can really, but of course, keeping you in the loop in terms of as we consider changes will definitely be one of our core recommendations, will be to make sure that they give you ample time to communicate, that there's ample approach for making sure you have time to change any links and information like that on documentation. Does that answer your question there, Lisa?
Yeah, it sounds like to continue to reach out to program staff if we actually want certain documents to include other information. So
yeah, that's right. Yeah, exactly. That's the right call. We're really, I would say reach out to us when you're specific to website unification concerns or problems that you have and feedback. That's kind of a that's a good opportunity. And then also to Karen's point, she just dropped in the chat, is that it's a multi-year approach, likely over the next 5 years, right? So this is just to keep this in mind, like we're here through September to really give recommendations and a roadmap. The implementations will take time, and they'll be phased, and they'll be taken care of by members of CDEC, and many of whom you are already aware of. So I would say keep those channels of communication that you already know about open, right? But in the meantime, in the next 3 months, as we start to work through this project and build those recommendations, we'd really like to get you all involved so that we understand really what your core needs are and the core needs of the groups and the different people that you may support.
Yeah, and to that effect, since I'll be developing change management plans for the effort, and want to ensure that the solutions are, effectively embraced, adopted, and used. And this is a multi-year thing. Would love to know any thoughts that you have on what has worked in the past and maybe not worked when providing you with information and support, and also other constituents within CDC. And with regard to website changes and their impacts. So for the sake of time, I don't think we can have that conversation right now, but if you could also email any of that information over to Chris, that would be greatly helpful. And I might be reaching back out to this group with that same question again in the future as well. Okay. For the sake of time, I think we can move to the next slide. So just really quickly, as I mentioned, we are taking a phased approach to the effort. Phase 1 was really our assessment period to get an understanding of the current state. We're now in phase 2, where we're building out that roadmap for the unification and the recommended changes. Looking into phase 3, we'll be working to establish some governance around it. But again, we're in phase 2 right now, establishing the roadmap, and this really involves gathering a lot of user input on the future state vision. And this is one of the reasons we're speaking to you all today. So I think Chris is going to go over some specific asks we have of this group.
Great. Thanks, Erin. Yeah, so when we're looking at the user research, so I see some comments in there about having beta testers or a group that we can review. And that's exactly what we're looking for. We're looking for individuals. And what we're looking for is we're looking for individuals from yourselves. We're also looking for individuals across other parts of the EC system. And we're really looking on specifically right now that provider professional workforce side of EC, and also the supporting services as well. So providers of EC services, EC service partners and intermediaries, EC professionals, family, friend, neighbor, caregivers, anybody who refers people to EC services too. So thinking pediatricians, social workers, these groups, and then other community partners, right? We've heard that sometimes families go to librarians or other educators and things to find information. We need to talk to about 5 to 10 of these individuals across all different groups for about 30 to 45 minutes each. And those will be one-to-one interviews. And we'd really like to find those if we can within the next week, or at latest the next 2 weeks. Those names will really help us. We'll have an interview, we'll walk them through the wireframes, we'll be collecting feedback, asking them to help us understand what those needs are. And that will really heavily influence how we build and how we recommend CDC unifies these websites. So if you have a name or two for us, you can put that your contact info in the chat, or just raise your hand so that we capture that in the chat. And then we can be in touch. Or as Erin mentioned already, you've got my email. That's Christopher.j.Jordan. Just make sure that you've got that middle J captured there, because there is another Christopher.Jordan with a K, strangely, at the state of Colorado. I'll drop it again one more time. .j.jordan@state.co.us. And please reach out to me with any names of people who you think might be interested. Or if you yourselves are open to having one of those 30 to 45-minute interviews, that would be highly, highly valuable to us. We really can't do this work without your input. So we hope to hear from some of you soon. So any questions, comments, If there's any information you'd like to know more about that interview process as well, or if there's groups that you're not sure if we're including at this time, I'm happy to answer those questions now. Okay. Will there be other times to provide feedback? Jennifer, can you, if you wouldn't mind coming off?
Sure. I asked that because we have a meeting once a month with my council, which is these diverse partnerships, and we don't meet until the second week of each month. So I know they would love to provide feedback for our rural area, but it won't be during this time. And some of my providers are also on vacation still.
Right. Thanks for that. And for others who have those similar concerns, I'm always open to hearing more feedback. I do need, like I said, 5 to 10 individuals as soon as possible, really right now. But later on, as you go through those conversations, you have your monthly touch points. We're happy to do a few things. One, we can present and we can come to one of your meetings and just gather feedback that way in a more general conversation. We can also, later on in the process, we may take these wireframes that we rebuild and validate them again. So we'd be open to seeing a new user perspective at that point. But in the meantime, for those of you who can reach out, or for those of you who do have the time yourselves right now, we really do need people within the next week or so, about 5 to 10 individuals. Jessica, I see you've got you raised your hand with your email, so we've got that down. Thank you very much for that. Any other questions?
We'll share your information in your PowerPoint, Chris, so after the meeting, so that'll get to all these folks on this call.
Great.
Yeah.
Great. Thank you so much, Karen. Appreciate that. And thank you both for inviting us today. With that, we're wrapped up, and we'll say thank you so much for your time, and have a lovely rest of your day, and have a great weekend too. All right.
Thank you, Christopher.
Thank you. Bye-bye.
All right, I know I saw Leah. Is Eva here too? Yes.
Yeah, hi.
Who I haven't seen in so long that I didn't even recognize a few days ago. Sorry.
That was funny, yes.
It's been a while. Well, it's great to see you guys.
Yeah, thanks for having us. I will share my screen. Oops. Let's see, there we go. All right. All right. Leanne, I just wanted to come on and say hello. I haven't seen folks for a little while, so just wanted to say hello and give a couple of end of fiscal year updates and beginning of new fiscal year updates. And then Leah has some updates she'll share about getting courses going. So first, I just wanted to say to all of the councils out there, thank you so much for being very responsive this July and getting invoices in and getting those estimates in. That was really helpful for our finance team and for us. So thank you. We are sending out budget award letters. They're going out to councils this week and next week. A couple of councils are submitting updated budgets, and so there's a deadline for next week for those budgets to be into me, and then I will send out those award letters as soon as those are received. So thanks for working on those as well. We have a materials request that is out for the EQIT courses. So materials will be coming to council soon. Leah may have a little bit more information on that. She's working on that right now, but that will be coming out in the next probably a couple of weeks. So some courses are up and running. Some courses are close to be starting. We have quite a few courses that are starting in August. So thanks for everyone who has been working hard to help get credentials in order and get all of those parts and pieces in place, and for reaching out to Leah to get your courses set up. If you have any questions or you're needing a follow-up or anything like that, please do reach out to Leah or I, or you can put anything in the chat right now. I also wanted to just recognize that we have quite a few folks who are infant toddler specialists who are currently taking, sorry for that acronym there, the Trauma Responsive Care training. It's a train the trainer. So this training is being run by the State Capacity Building Center, which is sort of our national support system that helps states implement different ideas, and they're kind of our coaches and our TA support. So they are running this trauma responsive care training. They have run it before, but this time around we have about 50 people who are taking this training right now. About half, maybe 30-ish or so, are infant toddler specialists who may be working with early childhood councils. Other folks are coaches who may or may not be working with early childhood councils. So for folks who are infant toddler specialists who have their credentials and are teaching EQIT, once they go through this train the trainer for trauma responsive care, it will be another opportunity for them to be able to teach this course in your communities. So it's kind of an exciting, potentially new, some people are already doing this in their communities, but potentially a new avenue and a new training method to be able to kind of tag on to the EQIT course. Arapahoe Early Childhood Council has been delivering this, and they've been very successful at sort of having this be like a secondary, almost additional follow-up training after the EQIT course has completed. They've had a really positive response, and it's been a powerful training to be able to talk about what it looks like to be responsive to trauma in our communities. So we'll continue to talk a little bit more about that. Yeah, oh, great. Thanks, Claudia. We'll talk more about what that might look like over this next fiscal year, probably in the coming months. But right now, I just wanted to say that a lot of folks are going through that training. So you might be hearing like, oh, we got certified. And so then we can start to think together about what that looks like to potentially run that in your courses or in your communities. Last, I wanted to just say, you may have received an email from Jen White. So thank you to Jen if she's on. She has really helped over this last year to develop some new systems to help us to kind of strengthen our invoice tracking process so that we have a better sense of where you all are with your spend downs, where you all are with your courses and coaching. So she has invited you to this area called Smartsheets. Many of you may have gotten that last week or early this week, and you might say, what the heck is this? This is going to be the place where I'm actually uploading and tracking your invoices that you send for EQ. So we've invited you to that space so that you can see basically what I'm seeing and seeing what I am doing. And it just kind of gives us an opportunity to have increased transparency and a space where we can, you can look at the numbers, I can look at the numbers, and you can say, oh, I thought it was supposed to be this. And then we can just have that conversation and make sure that that everything looks correct on both of our ends. So I just wanted to let you all know that that was sent out. I'm going to send out Jen White, Diane, sent out the invite. And it says Smartsheets. I'll send out an email about it next week as well, just so that there's additional information. But in order to access it, you will have to click on the Smartsheet link. You do have to set up a free account, but that's only because it requires a login and a password because it's a secure area where we're housing some of this data. But so only individuals who have been invited can see the information. It's a private, secure area that will only be between myself and whoever you've identified as your fiscal contacts, or your contacts that you've identified to us as your primary fiscal contacts for the EQ initiative. So I just wanted to mention that again, because I know that that may have gone out, and that folks might say, what is this? So I just wanted to make sure that that was out there. I'm hopeful that this year that will just continue to help all of us notice, like, oh, we're missing an invoice here, or that number doesn't look correct. I think it should be this, just to do some reconciliation as we kind of go along the year. So that is all I have for council information, and I'm going to hand it over to Leah to talk a little bit more about courses.
Absolutely. We're so excited about those changes. Yay. Thanks, Eva. Some of the other changes that we've been doing, we are now into, this is our third round of putting courses into PDIS, which is a great way for us to really be tracking EQ data. And so we really appreciate you joining along with us and going through that transition. We know it's tough to sometimes twice a year be putting courses in and be like, wait, but how do I do this? But in the long run, it's really going to give us some valuable information and streamline your process. One of those changes is that instead of Mary Heffernan being your contact for getting courses into PDIS and any questions you might have, is that I am that person right now. One of them being, you have very EQIT specific questions, and I'm your person for that. So please know that you are welcome to email me, and I'm happy to support you in talking about your schedules, making sure all of your specialists are approved, and then getting your courses in so that they can be accessible and available to your participants in your communities. So send me an email if you're ready. We were kind of on hold there for a little bit where we wanted to make sure everyone's courses are approved. But as of right now, I think I only have 2 or 3 councils that we haven't put their fall courses in. So please reach out if you need that support. One of the things that might be holding you up is if your infant toddler specialists aren't approved. And so we're still looking for those same things that we always have been. They need to have a current early childhood professional credential, level 3. They need to have a current trainer credential, and they need to apply for the infant toddler specialist trainer credential in the PDIS. I've been sending that out with our communication from EQ, but if you think, man, somebody should be qualified and they aren't, please just reach out and let me know. And I'm happy to get them supported and set up. I also want to give you the reminder that we're doing this right now to get everybody up to date and on the same page. And we will be renewing everyone annually starting in January. And part of that is to help streamline that process so that by the time Eva and Charlie and everybody are looking at you for what you're going to do for the next fiscal year, we have this part of the paperwork and requirements done. So you'll know exactly what you need and can just move forward. So those are all of my updates, and thank you.
I think we had this slide as well, Leah, but I think
That was
you just-
that same information. Yep,
Thank
so
you.
no worries.
Okay, thanks. And we will pass it along to the next person.
Thank you, EQIT. It's nice to have you both back, and we're very excited for this year. All right, we are going to move along to Erin Kendrick. There you are. Hello. You are muted.
Of course.
There you are. Hello.
Thank you for joining or having me. I appreciate the invite, and I know we're sort of short on time, so I'll try to speak rapidly. Because let's see, I have about 15 minutes. Is that right?
We had a 10-minute cushion at the end of the meeting, so don't feel rushed.
All right.
You're able to go a little bit longer too if you need.
Sounds good. Okay, well, let me grab my notes and then I'll share my screen. All right. Can you see my screen all right?
Looks good.
Okay. All right. Let me grab my notes, put them over here. And this never plays nice, so I apologize because Zoom is not my friend sometimes. Okay. So we'll go ahead and get started. Thank you so much for inviting me. My name is Erin Kendrick, and I am the WIC Outreach and Partnerships Coordinator at the Colorado Department of Public Health and Environment. All right, so I'll provide a quick overview of the WIC program and the impact, what's new, and then how to connect families to WIC. So what is WIC? The long name is the Special Supplemental Nutrition Program for Women, Infants, and Children, and again, otherwise known as WIC. And WIC serves pregnant and postpartum individuals, infants, and children under 5 years of age. The goal of the program is to keep families healthy and provide long-term health outcomes by participating. And we do this through 4 services. One is free healthy food, which you're probably already aware of, and then personalized nutrition education, breastfeeding support, and then resources and referrals to other programs and healthcare services, etc. WIC works. We connect families with supports that they need. As I just mentioned, that is outside of WIC, which is really important. And then we empower the caregivers to do the best they can for their family. You know, we meet them where they're at and try to personalize the education and the resources that we provide so they're useful for their family's needs. And then in terms of eligibility, we have 3 categories that need to be met. One is categorical. And so again, the individual must be pregnant or postpartum. So we serve postpartum individuals who are breastfeeding up to the infant's first birthday. If they're not breastfeeding or recently had a pregnancy loss, they can be on the program up to 6 months after the pregnancy has ended. And then infants, of course, as I mentioned, and children under 5 years of age, so up to their 5th birthday. They also need to meet our income eligibility requirements, and I'll talk more about that on the next slide. And they also have to live in Colorado. They do not need to have citizenship, and they do not need to provide any proof of visa status or anything like that. Alyssa loves that. Who receives WIC? I did just discuss the categories, so you can see a little visual of that here. And then a misnomer is that WIC is just for moms. That's not true. We welcome all caregivers. And so single fathers, grandparents that have guardianship of their children, foster parents, essentially any caregiver of a child under 5 years of age that qualifies for WIC can apply on behalf of the child. You know, the caveat with this is that the caregiver is not going to receive food benefits. You know, the child will. But we just want to make sure that everybody knows we welcome all caregivers and it's not just for moms. Then there's 2 ways to income qualify. The first way is through adjunctive eligibility. And the second way is through household income. And I'll explain that in a second. And for household income, folks need to make at least 185% or less than the federal poverty level. So adjunctive eligibility, we use this first in order to streamline the enrollment process. And so if someone in the family that's applying participates in Medicaid, SNAP, TANF, or FDPIR, which stands for Federal Distribution Program on Indian Reservations, current participation in any of these programs can potentially be used for financial eligibility. And so staff would just need to verify that they're currently participating in the program. And that tends to be easier sometimes than bringing in, you know, a bunch of pay stubs and looking for additional sources of income paperwork. So that's the first thing we try to do. Now, if they're not participating in any of those programs, then their household income must fall at or below 185% of the federal poverty level. And as you can see here, this is just an example of what that looks like for a weekly income, and that's before taxes. And these income guidelines change every year on July 1st. So they just recently changed. So, you know, if you do refer families, just make sure that you're providing the latest income guidelines, and those are always on our website, so you can access the latest information. If a family is over income, but the applicant is pregnant, we can actually use the pregnancy if the participant would like to do so, and count that onboard child as an individual. So for example, a pregnant woman who has a singleton pregnancy could be counted as 2. If they're pregnant with twins, they could be counted as 3, and so on and so forth. So that is another thing that WIC allows us to do, the federal regulations. And then foster children are counted as a household of 1. And so that's important to note as well, because a lot of foster families think that maybe they're over income because they're considering, you know, the parent or the caregiver's income when we're looking at the foster child's income. So that's another important thing to keep in mind. In terms of the foods that we provide, I won't go through the whole laundry list. A lot of you might be familiar with it, but there's specific foods that WIC provides. And I'd like everybody to keep in mind WIC is a supplemental nutrition program. And so we are not providing foods that should cover 100% of folks' diets. It is supplementing the current diet and with specific foods that are providing specific nutrients at specific times in life. And so that is why WIC doesn't allow, maybe potato chips or other types of foods, just specific foods for that growth, development purpose. And here's a basic list, but if you'd like to access all of the foods, I'll provide these links afterwards, but we have a hyperlink to our WIC food list and shopping guide, and that provides all the brands and just all the details so you could see the options that families have. And we try to update this list about every 6 months because we're always trying to expand the options as best as we can. And sometimes, a food manufacturer may no longer, make that product. So we'll have to remove it from that list too. So, we can always access our food list on our website. It's in multiple languages. I believe we have about 6 different versions for families that don't speak English. So that information is there if you need it. I would also like to mention USDA recently passed the revised food rule for WIC, which will actually expand our choices even more, which is awesome. But we won't be rolling those out until early 2026. There's a lot of behind the scenes work that needs to be done before we can release the revised food packages, but we're definitely looking forward to that. Food benefits, this is just the average monthly value. It can range anywhere between $79 a month to $121 a month. And that is not just a cash number. Food benefits are issued in quantities, like a certain amount of gallons per milk and a certain amount of ounces per cereal, for example. However, there is a financial amount provided for fresh fruits and vegetables. But on average, the package averages $79 to over $121 a month, depending on your category. And then there's about $6.9 million worth of WIC foods purchased per month in Colorado. And we have over 450 grocery stores that accept WIC. And so on our website, we also have a link to all those stores, as well as a WIC shopping app that our participants can find a store in their area. What's new with WIC? Some of these aren't super new, but might be new to you. We transitioned over from WIC checks to the eWIC card, which is a debit card that our participants can use at the store when shopping. And that card makes it much easier to shop. You don't have to buy everything at once. You can buy it throughout the month, which is great. We have a WIC shopping app, which again makes it much easier to shop at the store. You can scan products to see if they're WIC approved, and they'll also tell you if they're on your benefits. And so that's really important when you're shopping at the store, and it just makes the process easier. Now we have a new website, a couple years old, but newish. And then, of course, the fruit and vegetable benefit has been increased substantially. It's gone up about 3 to 4 times as much as it was pre-pandemic. During the pandemic, it did increase several times, which was amazing. And now it is been approved for long-term use. And so we are going to continue to provide the increased amount for fruits and vegetables. And we also have an online referral form. There's a hyperlink here, but it's coloradowicsignup.com, and it'll also be in the notes. And this is an online form that families can use to request a WIC appointment. And it's also a form that providers or partners or Head Start, early child care centers can also use to refer families with their consent, of course, to WIC, and then they're routed to agencies throughout the state based on zip code. And then the agency would contact the family to pre-screen and schedule an appointment. And we have flexible appointment options. You don't always have to be seen in person. In fact, since COVID, for over about 3.5 years, everything was remote. And then those waivers ended. And so now we have a hybrid option where there are some in-person appointments that might be required if we can't get the information we need, such as like a recent height, weight, or hemoglobin. But if that information is available from like a trusted healthcare provider or organization such as Head Start, then the client won't have to come in. They'll just need to provide that information to us, which is great. And so that allows them to complete appointments on the phone. We also have the option to do nutrition lessons online. So again, more flexibility, and you don't have to drag your kids into the clinic, which is never fun when you're a busy mom or parent. So how do you connect families to WIC? We are all over the state. We have over 100 clinics throughout the state, and we do have a map online, so just know that. The best way to connect families to WIC is to provide information to them. They can call and schedule an appointment. We do have brochures in about 7 different languages, and so I'll include a link to that as well in these notes. And then we do have the online referral form, and that's an easy way to refer families as well. The only caveat with the online referral form is I would just wanted to be transparent. Our state has seen a significant increase in caseload over the last year or two. And the agencies in our metro area, the Denver metro area, have seen a super significant increase. And so it may be harder or take longer for them to contact you than an agency outside the metro area. And so if a family really needs to be seen and get an appointment pretty quickly, I usually would recommend that they call, at least at this time. That might change, of course, in the next few months, but I just want to be transparent. If they need to get in quickly, calling any agency in the metro area might be easier than submitting a form. And then this last hyperlink would take you the Colorado WIC Partner Resources page, and that has all our outreach materials that are printable or could be shared electronically, brochures, posters, just more information. All right, I think I did it in time. I did it super fast. Might have missed some points, but I just wanted to make sure you had the overview and some basic information. And I'm sure most of you are familiar with the program, so this is not your first rodeo, but does anybody have any questions or comments or need more information, and I can provide in a follow-up?
I have a question.
Sure.
So, a lot of programs like to leave out flyers or one-pagers or pamphlets for families when they come and drop off and pick up their kids. And some of that can also be used for points in the Colorado Shines rating. So is there a good website or is there? Okay, cool.
Yeah, so on our partners resources page, we have outreach brochures in multiple languages. And we don't provide these and send them out. So you can definitely print them, fold them
Oh,
yourself.
awesome.
And we have multiple languages all listed here. So you can print, fold, you can share electronically. If you are connected with a local WIC agency in your area, you can also, if you have a partnership, follow up with them and see if they have any pre-printed versions they'd like to share if you don't want to do the printing yourself. But we are trying to move to everything digital. That's kind of the goal, so we don't have a lot of paper waste.
Yep.
Yep. And then we have outreach posters as well, in English and Spanish. Oh, sorry. But yeah, and those ones are just English and Spanish. And we also have the QR code that people can scan to get to our website with information on how to apply.
Cool.
Yeah, so yeah.
Awesome.
Any other questions? One other thing I'll share is that on the WIC online referral form, one of the referred by sources is Head Start. And so we do have, that to choose if Head Start organizations do refer families to WIC. And then we do have like an online data dashboard that shows how many referrals per month were submitted by that referral source and how many of those referrals were enrolled. And that's a statewide aggregate. It's not a local level data, but it's still useful if agencies are interested in that. Any other questions?
Right. Well, we have your information, and if you would like to share the PowerPoint with me, I can embed that into our agenda, and then folks can access it and share it with providers, or not the whole PowerPoint, but at least some of those resources.
Yeah. Yep. I can. I'll make these into slides and 6 per page, but all of the hyperlinks will be accessible from the PDF. So you might not have all the presenter notes, but hopefully you know that background info and you can just click and find more.
Yep, and we have this recorded as well. So yeah, just send that my way. We're so grateful for this partnership and that you took the time to join us today. Yeah, speaking as a parent, I know WIC it provides such invaluable resources to folks who really, really need them. It really changes lives. So we appreciate so much the work that you do and your partnership and collaboration with our community here.
Thank you. Well, thank you so much for having me. Thanks for all the love. I see all the comments going up. That's fantastic. And thank you guys for everything you do. Really appreciate it. Thanks. All right. Well, I will hop off and you guys can continue your day, and Charles, I'll send this your way.
Awesome. Thank you.
Okay. Bye. Thanks.
All right, gang. We're winding down. Thanks for hanging in there. Told you it'd be a busy one. We now have Christy, who is going to be Christy and Danielle, who are subbing in for Emily while she's out for a little bit. She will be back, don't worry. And they're going to give us an E&E update.
Hi, everybody. Good to be with you today. Charlie, can you share the presentation, or do you want me to drive? Okay.
No, I got it. Sorry, I forgot. I said I would.
That's okay. Okay. Well, like Charlie said, I am the interim E&E grants manager while Emily is out on leave, and I've got Danielle as my right hand person helping me out, and she has gotten me up to speed. So we can go to the next slide. Actually, yeah, next slide. And so Emily is slated to return at the end, or after August. So here we are. I've got some important updates for you. The first that I would like to talk to you about is the Sugar to Salesforce conversion. So our deadlines for this conversion are extending longer than we expected. But we are expecting, I keep saying the same word, sorry about that, it's for the conversion to be completed by the first week of September. So then I've got a note here that every council, regardless of spending, should pull the reconciliation report in Salesforce every month. This is best practices. Julie, I see that your hand is raised, and I will get to you as soon as I talk about the conversion. Okay. Specific to E&E, we want you to continue to use Sugar for your E&E requisitions that are already in process. All requisitions must be reconciled by August 31st, and really we'd like them done the week before that. Please do not start any new spending requests that can't be reconciled by that August 31st deadline. And then for those of you with E&E applications in process or that have been determined eligible and you need to transfer funds between categories, continue to submit the transfer funds requests. I've got a link on the last slide of this presentation that you can just click on, and if you need to transfer funds, you can do that. Okay, so I'll pause, and Julia, you can ask me your question.
Great. So a couple things. My understanding was that we would not have access to Sugar after July 31st. That's one thing. The second piece being, I know that I spoke with Michelle, and that the initial E&E information we had received was that spending had to be done by September 30th. However, of this year, but I'm now hearing we don't have to make sure they're done until September 30th of 2026. So I just want to make sure when it says not needing a new MOU, the current ones might have, I believe, have a footnote, but a lot of times providers don't look at that. So
Okay.
I have a few providers freaking out. So
Yeah.
that's kind of my, and so I was just going to send out a new MOU and change the end date. I just want to make sure that's okay.
Okay. I see that Karen came off of mute. I know that we have lots more information about this specifically, so I was just starting the conversation. So, Karen, if you want to add anything, or if we can continue with the presentation and then see if there's some clarification needed, what would be best, Karen?
Let me just address the question about the MOUs, because I know others have brought this forward. So if you've got somebody who's just, hey, I need a new MOU copy, you are welcome to like print out an MOU, change the dates, have everybody initial it, whatever. But if you've got, if you just want to send an email out to clarify to your providers that, even though the date says, refer them to the end note, and then just let them know that, we do have confirmation with the Colorado Department of Early Childhood that, spending can occur through September 2026. But yeah, I think Christy was going to say, it's totally fine to print out your MOU. We won't be reissuing MOUs in the new system. So that'll be for anything that's eligible. That's what we'll do. Currently eligible for new eligibility, a new MOU will then generate. So, but for your existing ones, just use the ones that you have.
Can I ask you a question then? Because in Salesforce, it says that I need to sign new MOUs for the 4 programs that are currently in there.
Yeah, those are all going to get deleted. So
okay.
That was a transition error that happened. So don't worry about any of those.
Thank you. That's what I was concerned about. Thank you so much.
Yeah, we just talked about that yesterday. So sorry. And there has been a change regarding the Sugar dates. And I know others are going to have this question too. Around that July 31st you brought up, we did communicate that we didn't want folks putting spending records into sugar. You know, honestly, some of this was getting mixed with CSQI versus E&E. And I think really we were just at a point where we're like, just don't do anything new. We're trying to fix what we've got. And so we've got a fix going in for all the permissions issues that we've been having tonight. So good news there. But we also have a change in just communication for you guys. We'll get it out on Chatter as well, so don't worry about that. That we can continue to use the sugar system through that August date for E&E only. So everything else has to be done because we're getting ready to just transition all that data. We're all getting wrapped up for that, but so hopefully that helps. So Chrissy, you can go on.
So yeah, if you're looking at the slide, we talked about this, the first box, sugar to Salesforce, the second box, MOU. So I'm going to talk about deadlines. Danielle and I are working through that applications and determining eligibility for some. They won't be marked eligible in Salesforce until the conversion is complete. And but we're going to notify you councils that the application will be marked eligible once we're able to, and then once the conversion is complete, then funding will be available. We are working on a 2-week cycle. So if we come to your application, we'll let you know what's needed, and we're going to give you 2 weeks out. And then we'll be moving on to the next application after that 2-week deadline if we haven't heard back from you just yet. We're working through the applications that are under review that you've prioritized, and for those that are on hold that you prioritize, we also move those to under review. And I've got links to both of those prioritization lists on that last slide. So, you know, anything you need in regards to E&E, you can click on that, and Danielle and I will get back to you. And lastly, like Karen said, just really watch the Chatter in Salesforce for the most recent updates. Next slide. So come to office hours. Yes, it's a time to ask your questions, but it's also, we've found it's like a workshop-y time where you're looking at the application and we're looking at the application, and we can actually get a lot accomplished at office hours. So I've got those links for you there. And then next slide. So these are the links to transfer the funds, to prioritize applications under review, and then applications that are on hold. There are about a dozen applications that we haven't heard back from the council about. So I would appreciate if you could just hop on there and just check your council and see if there are any applications that maybe have fallen off their radar, or should be withdrawn or not prioritized, and that will help us out greatly. Okay, last slide. So, any questions for me? Danielle, for Karen? H. Hop.
Heather, go ahead.
Sorry, thank you, Christy. So if we submitted a request for a transfer from coaching hours to dollars in the past, and that we were told we weren't doing that because everything was being transferred soon, can we resubmit that to have that process so we can go ahead and pay that provider that's been waiting reimbursement now for a while?
We can't move the funds, but we want the requests to come through so that once the conversion's complete, we can initiate those. And Karen, if you want to add anything.
Yeah, Heather, we might have to handle yours on a one-off. It's possible that we could work through the DECC team to maybe be able to make that adjustment manually. But we've got a meeting with them on Tuesday, and that was one of the things we were going to talk about to figure out that if we could still do that with the timing. There is a small chance that we might not be able to do it until September, but we're going to try. We'll get back to you on that. So
Yeah, 'cause
definitely do
those-
work. That's why we want.
Yeah, because we submitted that like at the end of May, and it would have been great. We would have been done and our spending would have been closed and everything, and we wouldn't have even had any requisition in that application to transfer. It would have been completely closed out for that entire program. So, and I'd really love to still do that because otherwise I'm going to end up, I don't know how long I don't know if I need to float that or what, Karen.
Yeah, just hang on that for a minute and let us figure that out. But if you would do me a favor, Heather, just shoot me a quick email so it doesn't fall off my radar, and then I'll get that on our agenda to talk to Jessica over at DECC and see what we can do.
Thank you.
With that. And we will prioritize that too if we find out we can make those moves.
Okay, and then I see Brittany's question. Do we have instructions for submitting new spending requests for E&E through Salesforce? Karen?
Well, I think we talked about that. So as long as you can reconcile those by 8/31, you can do that. But on the Salesforce side, until we have the data transferred over, we won't be doing E&E spending records. It'll be in September when we start that.
Okay. Any other questions for me?
I just want to, first shout out to Christy for stepping in for this work because it's a big job and we appreciate that. And then I just wanted to ask Danielle or any of the coordinators or Lilith if we missed anything that would be important to mention on the call.
Yeah, we're going to go into that next.
Awesome. Okay.
Before we do that, Mary Lynn, you raised your hand.
Yes, I'm wondering if we'll be able to reconcile August in sugar.
For E&E?
Yeah.
Yeah.
So we have to do it on the 31st. Is that what you're saying?
Yes.
You'll have it. Yeah, go ahead, Lilith.
Oh, just, yes, the reconciliation for anything before the 31st of August needs to happen before the 31st.
Yeah.
Because we will be pulling that information over and getting all the totals situated in Salesforce. And so, if this does mean that no new spending requests unless they can be reconciled before August 31st.
It could be coaching hours too, right?
I'm sorry?
We're doing some coaching?
Yes, yeah, as long as those can be reconciled by the 31st of August.
Okay, thank you.
Yeah, our target date on the cutover is 9/1, which is a Sunday, and usually it happens over a Saturday, Sunday time period, and then we test on Sunday. So just know that that's the target, and if that changes drastically, of course we'll communicate that out. But so that's why we're like 8/31 is the absolute deadline, but the week before would even be better. So
okay, thank you.
Yep. And then Jessica asked, so E&E questions come to me and then CSQI to your QRS coordinator. Okay. Great. Thanks so much. Happy to serve you.
Thanks, Christy. All right, gang. One last presentation. Lilith and I will be tag team in this. So I will go ahead and present. What we're going to talk about is MOU prioritization. So, last year was our first year that we ever had to prioritize MOUs because we actually ran out of QI funding. So we wanted to just kind of revisit this because we do have to kind of look at QI funding in a new way since it appears we have hit our limit. And while we would like to have more money and have it be, whoever wants the funding can receive it every year, Unfortunately, this is it's the state, and our funding is dependent on grants and other things that we don't always have that kind of control over. So wanted to just talk a little bit about MOU prioritization. So just a reminder, I have the business rules linked here and the MOU linked here, but it is expected that programs at level 1 will reach level 2 and submit for Colorado Shines level 3 to 5 rating within 24 months of signing an MOU with the ECC. And then level 2 programs must submit for a Colorado Shines rating assessment within 18 months of signing an MOU. I know the question that always comes up is, well, how are you tracking this? We don't have a formal tracking system. Part of the way this works, the way we perform this work is that the early childhood councils are really the ones who are in the weeds and in the know of their communities. And while we don't have we do have our, we can verify when programs have applied for ratings, we can pull this data if we need to. We don't have a formal tracking system for this. Julie, I see your hand raised. I'm just going to get to the end of this section real quick.
Just real quick, Charlie, I want to add something.
Yeah.
We will have a tracking system for this when everything is transitioned over into Salesforce. We will be able to get reports out for the MOU dates and the programs that are receiving them, like your level 1s and 2s. And then we will have to track, because we're being asked to do this by the Gov's office, who's level 1 signing, who's level 2 signing, and who's meeting those 18-month requirements and 24-month requirements. It's going to be part of our WIG goal next year, which I will get together with you guys in the next month to share all that stuff. But so we will be creating reporting against this once we have everything over in Salesforce. So good news, really, for everybody.
That is good news.
Yeah,
for sure. Okay. So let me just get to the end of this slide, Julia, then. All right. So yeah, this is just pulled directly from our business rules. So again, EC programs that complete a L3 to 5 rating, they need to either increase their average ERS score, increase their total points earned, or bump up a level to a 4 or 5. And early childhood programs that don't maintain a Colorado Shines level 3, 4, or 5 during a rating cycle would need to submit for another rating within 18 months. So that's just pulled from the business rules. Again, we're not trying to be punitive here. We're not trying to say, say this, you're going to have to pay back this huge amount of funding if you don't score perfectly on your rating. But we are starting to really push for quality improvement. And this is a way to demonstrate that. So let's see, Julia, yes.
Okay, so this has been something that's been on my radar and kind of monitoring over the last couple of years. And so what's going to be, now that we have Salesforce that seems to be able, hopefully, to track this a little bit better, is, in the next year, are we going to be expected to maintain like some kind of documentation on this? Or like I heard Karen just say, next year, after we get the transition done, we should be able to pull reports. And like for the level 3s, is there going to be something that we need to be monitoring on average? Because right now, a lot of times if people don't want to do it again, they don't.
Right.
And so, it's that piece around, how do you manage that? And with prioritization, we have those 4s and 5s that have to maintain. And you're talking about prioritizing. So I'm hearing your prioritization is around the level 1 and a 2 versus higher quality levels, which
not really true. Yeah, go ahead, Charlie.
To clarify, I'm not saying to prioritize any level. I think this is just a big picture. We want to look at how we want to be prioritizing. So if there's a program, for example, who year after year is a level 2 and signs an MOU and is receiving QI funding, but is never pushing for that high quality rating, that might be, you know, now might be a time to start having that conversation with them that, hey, you know, in the past, we've been able for you to receive this funding. And I know, you know, there have been extenuating circumstances, whatever, but if you're not following through on going through the rating, then you are not going to be receiving this funding. You know,
Right.
it's that kind of prioritization.
That makes more sense. Thank you so much.
Yeah. And it looks like Lilith was going to add on something like that. Michelle, do you have something else to add?
No.
And also, I just
No,
want to
you-
caveat this conversation. So we have gotten a few outreach questions from councils just saying it would be really nice if you guys would talk a little bit about prioritization. So that's what we're trying to do today. Bottom line, it's the council's responsibility to decide what's best for their communities around prioritization. We're just trying to give you some helpful hints and tips. And especially because I think, you know, we just are in a different space than from last year than we have been used to. So so just take this as you know, guidance, if you will. But absolutely, as part of your scope of work with the state, you should be tracking your MOU stuff. And I know some people do have tracking forms and they are you know, doing it manually right now, kinds of things. So, I mean, it's just that example that Charlie gave. So it's like, if you've got a level 1 or a level 2 provider that just, you know, they're not moving and they're sharing, you know, look, I'm not interested. That's really, under our business rules, a program we can't fund. They technically need to be following your MOU guidance. So just keep that in mind as well when you're wanting to think about, you know, what the priority should be for your community. Anyway, go ahead.
Yeah. That, I mean, the next slide is just listing some of those bullets. So are we verifying that programs are meeting the MOU requirements and meeting those rating timelines? You know, are there programs who are in the past have not followed through on coaching meetings, or have, you know, are not working with the council in that way, or not responding to emails, or are making themselves impossible to reach, things like that. Are reduced awards being considered? And that's just a big picture in the future. That's not something that we have right now, but that's just something that we're going to be considering. You know, a school district getting the same amount of award as just a regular center, a for-profit center or nonprofit center. Yeah, and rating timelines. It looks like I kind of repeated myself on some of those bullets. This was pulled from our meeting notes. So yeah, just things like that to consider. In general, we're looking for intentionality with the MOU, not just, you know, oh, we got 5 in the queue, we got to sign all 5 of them, but looking at them and saying, and looking at the programs behind the MOUs and thinking about, is this program going to successfully follow through with this MOU? So I'm going to stop there. That's the prioritization piece. And we're happy to talk this through with you at our check-ins or whenever else you want. Let's see. I'm curious if you're expecting a glitch with the MOU application and QRIS under the classrooms tab. Nicole, sometimes when that happens, there are old classrooms on the back end that need to be deleted. So just send that.
Yeah, send a help desk request.
All right. Lilith,
We
am I
did have
okay to-
we did have a glitch real quick. We did have a glitch with
Yeah.
classrooms. A few of you reported that, you know, more money got allocated than should have been allocated because there were some classrooms. We found the issue yesterday. And so that, if you do see that, please just report it into the help desk because we're just making the adjustment manually. But going forward, I think after tonight, I think there's a fix going in tonight for that. That shouldn't be happening anymore. Basically what we found was that there's a few programs in there that had like multi-purpose rooms as a classroom. And so it was counting that. And now we've filtered those out. We filtered out school age, and we filtered out the anything that isn't considered infant, toddler, or preschool. So it's just, thankfully it was an easy fix. But yeah, if you see any more of those, just give us a heads up on those through the help desk, and we'll get those corrected for you quickly. Go ahead, Julia.
I'm sorry. I don't mean to be difficult. I literally just went through this morning and checked every program that's applied. Do I need to wait till tomorrow and review them all again?
You're good.
I'm good? Okay.
Yeah,
That's all
you're
I-
good. You don't have to redo that if you haven't found them. Unless somebody does something between now and this overnight, you're probably just fine.
Yeah, it's not going to auto-correct anything. It's just going forward. It won't make that same error. Okay, cool. Let's talk updates. I know we're kind of zooming to the end here. Lil, do you want to give an update on the QI module?
Yes. So we talked a little bit about this right now. We are, and I didn't correct this here. So working on funding streams, populated data pulled. We'll move that to funding streams. We'll address that in just a sec. Yes, we are, you know, if there were still programs that you caught that came after, hopefully the bug is fixed, please let us know if you're still seeing that. But after tonight, there is a fix, bug fix is set to deploy tonight, and these updates should be basically correcting permissions issues, which have been affecting a whole wide range of things, including the creation of coaching logs, as well as another fix to kind of correct this incorrect org that was distributed for a couple of programs, quite a few. So like I said, these updates should be set to deploy tonight, meaning tomorrow morning, things should be up and running. I would continue to monitor that QI module chatter for important updates, because if there is anything related to this, you will see it there. And as well as checking, I've included a link here to the QI help documents that we have so far, as far as like providers applying for QI funds and councils approving QI funds and things like that. So I know some people love to download the guides and have them ready. I would advise for now, since so many little things have popped up and we've had to do a couple workarounds and the system's still new and we're all in it together, I would advise for now to be checking this link for the help documents. So maybe just click on this link when we send it out afterwards, and you can star it and just be aware that, you know, some of those guides might be updated as of, you know, yesterday. So just making sure that you're not using outdated old materials, and, you know, when we've got all these bug fixes in place and things are really running smoothly, we can definitely, you know, move them to a different place for you to download, or you can download them and have them and not worry that something will be updated, but just making sure that you have the most up-to-date resources. Going to funding streams, kind of taking that first one out of QI module, we're working on getting funding streams populated and data pulled. If you've got programs that are waitlisted, you can let your QIS coordinator know, and they can move funding from maybe a funding stream that isn't being used so much to the funding stream that has a lot of applications. So whether that's you've got a ton of TSQI applications and you're not having so many ESQI applications, we can move some funding from ESQI to TSQI or vice versa. We are kind of jumping down to that next bullet. We're developing a future process to allow grant leads to move funding between their council funding streams, but that will take a little bit of time to go through that process and get it implemented. And so for now, again, if you've got programs that are waitlisted and you've got some funding in a different fund, your other funding stream that you're not using so much of, you don't have as many applications there, just let your coordinator know and they can get that funding moved. And coordinators are meeting on 7:30 to finalize, so next week, finalize the process of putting additional funding into council funding streams, which should be ready to go by 8/1. So I know a couple of my councils have been asking about this, and we're definitely hearing it, and we're getting that process and finalizing it next week. And then the last thing here is annual report is due, guys. Yay! Way back when Megan was talking to us about shared measures, I've updated a few links in the annual report, and those included the shared measures links that are more recent years, so that you can actually get valuable data from last year as opposed to this year. So I've also updated a report on the impact tab, and that name doesn't have to stick, but it's kind of, I renamed it because we weren't using that tab for some other stuff anymore. And so I did update a report on that tab, and I've included it here. So when these notes get sent out, you'll be able to access it. And just let me know if you have any questions, concerns, thoughts. But again, annual report is due 8/15 of this year. And there's just a few links. So just make sure if you've made like a copy of the annual report, totally cool. But just make sure to check the original for this year, 23-24, to get those updated links. Because I think I ran across a few that had copies, and I was not able to update reports in those copies. So just so you all can have access to this. And I think, Charlie, did you want to do this part, or do you want me? Because I think that was it for my.
We have a couple questions here, and sorry about that spinning chicken. That was very distracting. I didn't.
As I was looking at it, you're like, what am I reading?
I don't know. Okay, so when can programs use their spending requests? When is that going to open up? And it sounds like that will probably be.
Great question. That should be set to start Friday morning after these bug fixes that were on the last page that we just talked about. So that the permissions bugs were affecting a whole bunch of random weird stuff. And so we just really wanted to test that. The development team needed to test that thoroughly to make sure that everything was working. So we can update you further, but as it is looking right now, that fix is going to make it so that QRIS spending can occur. And again, if you check that link on the last page, then you will see updated instructions for submitting spending requests. So only providers can be submitting spending requests in the QRIS portal. It's very streamlined. It looks lovely. And if you have any questions, of course, reach out to me, Charlie, or Michelle. Not currently waitlisted by 7:30. Can programs still submit applications for MOUs? Yes. If you've got funding in your funding stream, they can submit and you can accept them. If you do not have funding in your funding stream, they will be waitlisted. And then after that, we will be putting more funding in, and then probably on the admin side of things, going through and making sure that those programs that are waitlisted will have access to that funding. I know there's also an update that will be prioritized at a later date so that grant leads can go through and say, okay, this program waitlisted, I want to accept them and give them funding. But that is currently in production, and so we do not have that ability yet. So it will be a Salesforce admin individual who will need to go through and just make sure that all your programs are moved out of that waitlisted status.
And there will be other, like hopefully funding in addition, not just covering those that are waitlisted, but enough to cover additional applications as well.
Yes, that is correct.
Did I hear you say we were prioritizing QI grant applications? There's potential that QI funds may not be available. So last year we did run out of funding, and not everyone who applied was able to receive funding. So Yes.
Yeah. We have funding right now, but
Right,
you know,
not anytime soon, but
Yeah.
yeah, it's not guaranteed.
and just like a quick note, in talking with one of my councils today, we did see a bigger influx of MOUs, providers applying for QI funding in this first quarter. You know, not first quarter's not even done yet, but in this first month or so, we did see a lot more providers applying because the funds ran out last year, and so I think that's what prompted it. I believe that a lot of councils really outreached and made sure that their providers knew to that the new system was coming, that they needed to apply, and so I think that plays really, really heavily into where we're at right now.
Yeah. Okay, so real quick, I did a presentation about yeah, Tiffany, what's up?
So just going with this slide, and I'm sorry, I have to jump off to another meeting. So the minor improvement requests for that letter or for the intent, they do need to have 3 bids. Is that correct before sending that application?
So there's the intent.
Okay.
Yeah, they'll need to have 3 bids, 2 with extenuating circumstances. And yeah, the hope is that they would have those bids when they filled out that intent to apply. So just refer to that PowerPoint. I presented on that last month, but basically the application itself.
Oh, Charlie, did you?
Yes, sorry, I just lost connection. Great timing.
No worries. I was like, I don't know if it's my computer or not.
That was me. And then let's see. Oh yeah, that's it. Oh, there was one more point on this one before. I know it looked like in the email that there was a reduced funding amount. The $7,500 amount is not changed. We were just saying that there will be fewer minor improvement awards being able to be given because we wanted to prioritize regular QI. So still
We
same
actually
amount.
budgeted for the same amount as last year. So, and I can't remember the number, it's like 240,000 or something like that. So it's really not reduced. It's just, we're going through this process so we can make sure. We had a couple of bad situations last year where people were given the impression the money would be there. The money wasn't there. These were things that, even I know you all heard a few really upset providers. We're just trying to avoid that to make sure we don't, have that situation. So we're just asking people, be prepared, just be prepared, and we will prioritize the applications for the amount of funding that we have set aside to do that with.
Right. I believe that's it. Yeah, any last minute questions? Can programs begin spending now? Hopefully by Friday, right? Tonight is the quick hot fix.
Tonight is the quick hot fix, and that should clear up those permissions. And then seeing programs with minor improvement grant application accessible. I think that's because if they are a TSQI MOU holder, they have a level 2 or higher, and they have infant and toddler, then that is why they might see that button, but there is no money in the in that request right now, and so your council would need to fill out that form for that request or intent. We as QRS coordinators would review that, and then we would put in funding so that programs can request those minor improvement. And I was addressing Karen Thiel's question in the chat. So yes, wait for spending until tomorrow, as the update going through tonight should be resolving most of those issues. And coaching logs, Amanda, yes, as far as we are understanding, those issues will be resolved tonight with that update that will go out. And yeah.
So Lilith, this is Julia. I'm sorry. I know we're at the end and I'm going to come off. So I just have a question. I know we have the application link for minor improvements, but are you saying that providers can see that link as well? Like they have a button in Salesforce?
Providers will be able to see a button that says that they can create minor improvement requests. If they have a TSQI approved MOU and they are level 2 or higher, and they have their infant and they serve infant and toddler. So they'll be able to see
So
it.
how does council review that prior to it going to you, Michelle or Charlie? See, for me, and what we've done for years past is we review them all to ensure it meets the requirements and it fits within alignment for spending requirements at the college. So thinking of them to be able to just apply, that's not what we are trying to tell them. We're asking them to send us everything first to review. And so I just feel like, it feels awkward to me that stuff is going to come straight to you before I get a chance to see it, to ensure it meets the requirements, because if it has to be fixed, that's going to be on me, on our team, not you guys necessarily. So I guess I just don't, I don't understand because, I'm trying to understand because we created a whole form where they're going to let us know what they want and how to do it. And then we would submit for them should they, on the Google Doc or Smart Form, I don't know what it's called. But just to make sure that it makes sense.
So I actually have to jump off to go get my son, Julia. I'm happy to continue this conversation as well, or if other individuals can answer this, but I have to jump off. I'm so sorry.
Can we add us next office hours?
I'm sorry, Karen, what?
Can we add this topic to the next office hours?
Yes, I will get that set up later on when I'm back picking up my son. I will get an office hours going out and we can address this. Julia, if you want to send me an email with just a little bit more information or just a blurb that
I think
can
it's
kind of
just
use.
walking through the process A to Z. So
yes,
we can,
absolutely. Yeah. Thank you, Karen. Thank you, Lilith.
Of course.
All righty, gang. Thanks for hanging
And thank
on
you
there.
guys, my gosh, for hanging out with us extra 8
We
minutes
appreciate-
at this point. Thanks.
I guess it's a busy summer. We appreciate you all so much. If you have leftover questions, you know how to get in touch with us, help desk, or email your coordinators. We know it's been just kind of a roller coaster ride kickoff to this fiscal year, but we'll get through it like we always do. And we just appreciate you all so much. Have a wonderful rest of your day.
Thank you, everybody. Thanks.